Cataracts are stealing your vision. Yes, it's even among the number one cause of blindness. Please, let's take note. But what surprised me is if most of us come across the word cataract, we tend to ignore or we usually take it for granted. If you know how fast cataract is stealing our vision, you will never take it for granted. Now, what are the likely causes of this cataract? What are the signs and symptoms of this cataract that is stealing our vision? What are the treatments that can be given after you have developed cataract, and what are the preventions? Possible preventions. Prevention is better and cheaper to cure. Please just pay attention to the end of this video, and I promise you your life will never remain the same again. Now, in a village, there was these two women that engaged in a fight. Unfortunately, one got a dirty slap in her face, and the two of the women's finger hit her on her eyeball. Now, 4 months after, shortly, she developed cataract. And meanwhile, during all this time that they've been fighting, they were keeping malice. They've never been talking to each other. They now have to take this case to the king's palace for judgment. On getting to the king's palace, you know, there will be kingmakers, there will be chiefs and other people, you know, that will partake in the judgment. The first chief rose up and said, "You, this woman, you and your friends were fighting and you deliberately got her blind. Do you know the whole village has known you to be a witch?" Everybody, you know, were amazed. He said, "So, can you tell me," she now asked the woman that got a slap, "can you tell me the hand that she used to slap you?" She responded, she said she used her right hand. The chief now moved closer to this woman. She raised up her right hand, showing them there is a local ring there. Definitely the woman has deliberately did what she has done to got her blind. So, and all the judgment was just revolving around this particular point. What are we talking about? Ignorance. Can you see the consequence of ignorance? How far it has taken us? So, when we are talking about knowledge is power, please don't take it for granted. I'm your brother and your friend, Stephen Oluwatumininu. What are these likely causes of cataract? Let's talk about that. Number one, we have age. As we advance in age, you know, cataract is an opacity of natural crystalline lens. Our lens in the eyes is usually very transparent and is of crystal clear. That's why we call it natural crystalline lens. It is transparent, and as a result of advancing in age, gradually there will be a deposition, you know, of fat and all other deposits from the blood into the lens, and gradually it becomes opaque. I usually say if you buy a new mirror, the mirror will be very clear and you will be seeing yourself clearly in that mirror. But just put it maybe beside the window. Let there be continuous depositions of dust and other particles on it. It will get to a stage that you won't be able to see your image at all in the mirror. That is exactly how our lens in our eyes is. That is gradually, as a result of advancing in age, it becomes cloudy and opaque. And you know, light don't pass through an opaque medium. Now there's what we call refractive media of the eye. We have the cornea, we have the aqueous humor, which is the fluid in the anterior segment of the eye. We have the lens, which we're talking about. Then we have the vitreous humor, which is the fluid at the back of the eye. And we have the retina, which is a light-sensitive tissue at the back of our eye that partake in transformation of the light that is being shined into the eyes. It will transform it into an electrical impulse, because the optic nerve can only transmit image of light in an electrical impulse from the eye to the brain. Like I do compare our eyes to a car. A car is built with the headlight. It has a wire that connects the headlight to the battery. So our eyes, we have our eyeballs, we have optic nerve that connect the eyeball to the brain, and our brain is representing the battery of a car. That is how it works. So opacity of this natural crystalline lens, light don't pass through an opaque medium, and that is why we easily be having blurring vision, you know, foggy vision when it starts developing, and all these occur as a result of old age. Apart from the old age, another cause are medical conditions. We have medical conditions like diabetes. Diabetes is an increase in the content of blood, in the content of glucose in the blood. And gradually, you know, blood is being supplied to various parts of these our eyes. So this increase in glucose content supply and deposition into the lens will result into gradual fogginess cloudiness and opacity of this natural crystalline lens. And mind you, I told you light don't pass through an opaque medium, and that's why we start be experiencing cloudy vision, gradual loss of vision is as a result of diabetes. Also glaucoma, it occurs like that. Increase in the pressure of the water in the eye, increase in intraocular pressure. There's water in front of the lens and at the back of the lens, and as a result of increase in their pressure, it infiltrates into the lens, alter the density of the lens, it becomes edematous, opaque, then leading into cataract. Another one, we have uveitis, which is the inflammation of uvea tract. What is the uvea tract? The uvea tract starts from the iris, ciliary body, and the choroid. That is why I say whenever you have any complaints in your eye, just move close to the next nearby eye specialist. Let them diagnose you well and give you prompt treatment instead of you inviting additional complications to your eye. Please, let's take note. And we have many more of all these medical conditions. Another causes of cataract is lifestyle. Lifestyle like smoking can easily cause cloudiness of our lens, leading into development of cataract. Also, we have prolonged exposure to ultraviolet rays from the sun. Those of us that work in the sun, that we are being prolonged exposed to ultraviolet rays. Instead of using goggle, we don't do that. It precipitates the quick maturation of cataract. Also, exposure to X-ray radiation, maybe from phototherapy in treatment of cancer and other diseases. Please, let's take note. All these things can precipitate or increase the risk of developing cataract. Another one is inadequate diet. When you are taking diet that is lacking in vitamin A, C, E, even antioxidants, they can increase your risk of developing cataract. All this thing was well explained in my last video. Is there at Oluwatumininu Steven on YouTube. You get many more of all these essential nutrients that will be of benefit to our vision. Now, another cause apart from the lifestyle is when we talk about trauma. Trauma to your eyes, like what just happened in the story that I first narrated at the beginning of the video. The woman got complicated cataract, traumatic cataract as a result of the trauma she had. Is an example of trauma. When someone hits you with slap in your eyes, blunt, anything like blunt force can easily precipitate the development of cataract. You are playing ball and ball hits you in the eyes, you can develop cataract. Even fist, when someone gives you a blow in the eye, you can develop cataract. You are walking at night when there's no light and you hit your face against the wall, you can easily develop cataract. Please, let's take note of this. Then, apart from trauma, we have medications like prolonged use of steroids. Some women of nowadays, when they want to get fat, they want their bum to increase in size, they will place them, or they will place themselves, because no medical practitioner that will place you on that. They will now place themselves on steroid like dexamethasone, prednisolone tablet. They will now take a larger dose, even in a continuous form of it. Do you know what you are getting? You are getting obese as a side effect of this steroid intake, and you think you are getting fatter. Is a disease, and as a result of this, it precipitates the development of cataract that we don't know. Please, let's take note of this. It is very bad for our health. Another thing is genetics. It runs in some blood. If you see your mother and your grandmother, some of them having this cataract developing, yes, there's been a proof that in the gene that it can be transmitted. Please, let's take note of this. Now, let's talk about the manifestations. What are the signs and symptoms that you can begin to see that you will know that you are developing cataract? Number one is blurring vision. I've explained the process, how this develops. When you start having blurring vision, then definitely you should know that you are developing cataract gradually. Photophobia, sensitivity to light. When light is being shined into your eyes, you don't want to look. Photophobia is an example or one of the signs and symptoms of cataract. Difficulty in driving at night or color halos. When you are driving at night and maybe you come across oncoming vehicle that now shine light into your eyes, it will look scattered, that you even eventually almost falling into the drainage. All these are signs and symptoms of cataract developing in your eyes. Difficulty in reading tiny words. You are realizing that we can no longer read, legibly, until you have to extend your book very farther before you can see clearly, or your phone, you have to extend it very farther before you can see clearly. All these are signs and symptoms of cataract. Frequent changes of reading glasses. When you are frequently changing your reading glasses in an attempt so that you can be able to see clearer as you used to see before, all these are symptoms of cataract. It's telling you that now the contractility of the lens is gradually being affected. Suspensory ligaments usually pull lens upward and it will become elongated. When you want to focus at a distant object, when you want to focus at a close object, it will contract and become engorged. Now, when this lens is gradually becoming opaque, cloudy, the flexibility of this lens will be altered, and likewise your reading ability will be altered, and that's why we usually prescribe glasses of various power for you people. All these are signs and symptoms of having cataract. Gradual loss of vision. You are noticing that the way you used to see before, it has not been clear like the way you used to see before. It's an indication that you are gradually developing cataract. Please, let's take note of this. Now, what are the prevention? How do we prevent this from occurring? Because like I usually say, prevention is better and cheaper to cure. Number one, we talk of age. As you are advancing in age, always go for regular eye checkup. When there's anything developing in your eye, they will have informed you. If it is diet that you need to take, they will tell you, or whatever is the cause. Another thing is medical conditions. When you are suffering from diabetes, make sure you always get your sugar level controlled. The same happens to hypertension. The same happens. We have hypertensive retinopathy. We have diabetic retinopathy. All these systemic diseases has their adverse effect on the eye. They affect our eye, causing blindness. So when you are suffering from any conditions, even glaucoma, you have glaucoma doesn't mean you cannot have cataract. Of course. So when you have any diseases, either systemically or in the eye, please try to go to the hospital and get the quick care that you require, because like I usually say, accurate and quick diagnosis always lead to a better prognosis. The earlier you are able to diagnose any illness in the body, the better the prognosis will be for you. Another thing is lifestyle. Those of us smoking, we need to quit smoking. It is very, very devastating to our health. Apart from causing lung cancer, destroying our liver, it causes or increases the risk of developing cataract. Please, let's endeavor and take note of this. We have so many things that we've talked about. When you start having gradual loss of vision, it is an indication. Don't just assume. Move to the nearby clinic, eye specialist. Let them inspect your eye and tell you the possible solutions to what is wrong with you. Now, how do we manage cataract? Honestly, number one thing is when you start developing all these signs and symptoms that we've discussed so far, they will try to place you on glasses. Whether glasses will be able to help you to read further or better. Because by the time you begin to extend your reading, or your book to a farther distance before you can be able to see, it is very bad. To get to a state that you won't even be able to see it again. You begin to jump lines when reading and it becomes so foggy. So we'll try to place you on glasses to help you read more better. Then apart from glasses, we can place you on some vitamins. Most of the vitamins that are lacking in your diet, like the A, C, E, antioxidant, amphetamines, all these things you can be prescribed on. Even we have some, eye drops that will help you to function till when this cataract is fully matured and the surgery will be done. Then finally, the final treatment of all cataract is surgery. Yes, you just have to undergo surgery where this opaque lens will be removed and replaced with an artificial one that can never become opaque again. Then you begin to see like you used to see before. And we have different types of cataract surgery. We have extracapsular cataract extraction, ECCE. We have small incision cataract surgery. Those ones are just new invention. We have focal emulsification. All these are different types of cataract surgery. But prevention is better and cheaper to cure. Those of you that are working in the sun, that engage in prolonged exposure to sunlight or ultraviolet ray, why can't you be putting on your eye goggle? Take note of all these occupational protective measures or to prevent occupational hazard. Put on your protective measures when you are working, any kind of work you might be involved in. Please, they are very, very important. By the time you start noticing that someone is coming from afar and you can't identify his or her face, until the person is getting closer, is an indication that you are developing cataract. Visit the nearby eye specialist. Let them diagnose you and give you the adequate treatment that you need in time. Please, if you've benefited from my video, don't forget to press the subscription button, subscribe to my videos, like, share, and comment. If you have any clarifications, put it in the comment section and I will respond to you as quickly as possible. I will never take you for granted. Thanks for watching my video, because I realize anytime I drop my video, all of you come and watch it. Yes, you are the one motivating me and being motivated by your views. Thank you and God bless you.